All right, everyone, I am here with my lovely patient, and she is our first guest, and we are very excited. She's 3 months out from her surgeries. We're going to go into all the information, and she's agreed to kind of share her side of the story, how she's gone into plastic surgery, how the process was, how the recovery was, and how it has changed her life. So we're going to kind of delve into these topics today. We're very excited. And so I'm Dr. Deigni. I'm a board certified plastic surgeon in Houston, Texas. And please go ahead and introduce yourself.
Hi, yes. Good afternoon. My name is Glesha, and I am so excited to be here, Dr. Deigni. I am very happy that you've chosen me to be the first for your series here, because I definitely want to help others and encourage them to definitely make this move.
We appreciate it. All right. Well, we'll start with the first question. Tell us about what motivated you to have plastic surgery.
Well, it's something that I have thought of for many years. And I just decided, you know what, I'm going to stop just thinking about it, and I'm going to do the research and start putting it into action, because I didn't want to wait any longer. I was a little embarrassed that my clothes did not fit the way I wanted them to fit. And, even though after years, I'm pretty, I won't say athletic, but I have a nice exercise routine. I'm very conscious of what I eat, exercising, but I just wasn't getting the results. The results just wasn't there. And I would continuously think about, how I wanted to look and how I wanted to feel, and I said, okay, Glesha, you need to stop thinking about it and do something about it. And that's what brought me to you.
Okay. And at that time, you had already had children.
Yes.
You had been through quite a number of years in your life, growing up, being adults, and also career-wise and all that. So that's a different point in your life as well.
Yes.
Okay. Wonderful.
Yes. I'm a grandmother now, and, just recently remarried.
Okay. Wonderful.
And with all of that.
I think you did mention that mommy makeover was a term that you didn't feel was appropriate for you. You wanted to be a grandmommy makeover or something like that. I've never heard that before.
Yes, exactly. I'm like, okay, I think I'm past the mommy makeover. Maybe we need to do something else here. But yeah, I just really wanted to feel good about myself. The second half of my life, I felt that, I've poured into my family and poured into my career. And I just needed to pour something into me. I needed to do something for Glesha that would fulfill me. And this did that.
Wonderful. Tell us about how you went about doing your research and finding us.
So originally I had maybe 4 or 5 different doctors that I was following online, and doing my research, and especially having my daughter actually started helping me as well. The millennials, they get really deep into doing their research and everything. And it was like something about you. When I went on TikTok and Instagram, and I was just watching you, and I really enjoyed how you took your time explaining things. I could tell that you genuinely wanted people to feel comfortable. You wanted them to be pleased, and it was just like you just was holding your patient's hands and your bedside manner and everything. I just felt that I needed someone that didn't want to do it just for the looks or just for the likes, or someone that really intentionally cared about their patients. And I felt that from your spirit, your energy just on camera. I felt that.
Well, thank you very much. I appreciate hearing that. And I'm glad that brought you in.
Yes, it did.
How was the process of booking your appointment and then actually coming in for your consultation?
Oh, wow. So when I booked my appointment, that was another thing. Talking to Linda, she was very warm. She was very patient. I think she could tell I was a little nervous, but she reassured me that, the process was going to go smooth, and that I had the support that I need from the office and your staff. And so just talking to her and then finally coming in to meet you, I was sold. I felt even better when I walked out that, okay, I'm definitely making the right decision. I've selected the right doctor, selected the right team, and I was going to have the results that I wanted.
Oh, wonderful. We're very happy to hear that. It can be daunting and difficult to actually be able to find the right team.
Yes.
So I always tell anybody that is interested in having plastic surgery to do the research, get to talk to the staff, get to talk to the surgeon, and just see if you have that chemistry.
Yes.
Yeah.
And I told you I saved your video from Great Day Houston.
You did.
Yeah,
Yes.
from 2017.
That's right.
And I kept that. So you were always on my mind, to really do the follow up. But having watched that and then going back and doing my own research, I felt comfortable.
Oh, wonderful. Wow, I forgot about Great Day Houston.
Yes.
At the beginning of my career. What procedures did you get?
Oh, wow. Like, what procedures didn't I get? I had a lot. So I was laughing because I think I had the bundle package.
We did.
So, of course, I had the tummy tuck.
Mm-hmm.
I had the lipo.
Yes.
I had the fat transfer.
Yes.
To my breasts instead of considering any type of, implants or anything because I didn't want to have that done.
Mm-hmm.
But I will say a few women that I discussed that I was going to have this procedure, they really encouraged me to make sure I had the fat transfer in the lift in the breast area because of the tummy tuck, because of the skin and the pulling and everything. They said that over the years, women who've had that done, they later regretted not having that procedure done during that time to the breast, and they had to go back. And so I already knew that if I was going to do this, I wanted to go all the way and get everything done one time.
Okay.
So I did that. And I'm very pleased that I had all of that done at the same time. And of course, in the back area to the bra line, I had that suction, taken care of as well.
Any reason why you didn't want to have implants and you preferred to have the fat?
Well, the first, I was just concerned because I always hear good and bad. People having a bad experience years later, and have it removed. So I didn't want to have to, even have that thought of doing that later on. And just doing homework once again after talking to you, I felt that would be a better alternative for me to do the fat transfer.
Wonderful.
And I'm like, hey, what am I gonna do with this fat anyway? Let's use it.
If we can do the liposuction, might as well use it somewhere.
Might as well use it.
Right.
Yes.
And how was your recovery process, especially having gotten all of these procedures at
Oh my
once?
goodness, my recovery. People always still say to this day, they think it's like, oh my God, you had a miracle worker, okay? Because most people, when they have this type of surgery, they are like laid out, and so that was another concern. I felt that, once I had the surgery done, I was going to be in the bed for days, for weeks, for months, not being able to move, can't get up. Well, let me tell you, day 2, I was out of the bed, ready to move around. I think my husband talked to you and you said, no, tell her to, relax, just relax a little bit. But I really felt great. I mean, of course, you feel a little minor discomfort. I didn't have to take the pain meds like I thought I would, but I followed your directions. And I really felt wonderful. And I was so pleased that, that my recovery time was what it was.
Wonderful. And we also did the drainage technique.
Yes.
Which does help with the smoother and faster recovery. But you have recovered extremely well. And I was very, very pleased with how you were coming along. So
yes. Thank you.
Amazing.
I listened to you. I followed your directions.
So, again, I was going to say, when did you start feeling comfortable again? I know you said by day 2 you're already up, moving and everything. How soon after?
Within a week, really, I was really able to move around and go outside and, and just do a little things around the house that I wanted to do. But I wasn't just like confined to the bed or confined to sit down. I was up moving around right away. So within a week, I really started to regain my strength.
Excellent.
Yeah.
Excellent. All right. There is a roller coaster of emotions that comes with having surgery. And we have to guide some patients through it. How was it for you? What did you feel?
Initially, right after surgery, you laying in the bed and I'm thinking, okay, how am I going to really look? Like what is going to be the final outcome of this? Because initially, you're swollen and, you still have the stitches and, the bandages, the garments, so you have no clue. You're looking at yourself like, oh my goodness, I look like I was like dissected, like what's going on with my body? Am I going to look the same, later? So that was going through my head initially, right? And just moving forward, am I going to have any other issues later? Am I really going to be able to, move around and do the things that I used to do? How is my body going to feel with the numbness, how long is that going to take to heal? All those things was running through my head, like, did I do the right thing?
Yeah.
Am I going to be okay? Especially being a woman of a certain age, a little
Yes.
older, so the bounce back time, you're not sure.
Right. Well, it did help that you were definitely fit, working out, already having that in your lifestyle,
Yes.
which is good.
Yes.
But you're right. All those emotions can come, and some women it may take longer. So we definitely hold their hands, encourage them, because there is a period where with the recovery, the swelling, the aching, and then trying to get back to be able to wash yourself,
Yes.
take care of yourself, eat, because the appetite also takes time to come
Yes.
back. But as we coach them and they get through it, they bounce back. And by the time I usually see them around 3 weeks, so their second follow-up appointment, they're doing great. I think you, by the first time
Yes,
I even
yes,
saw
I
you,
feel great. Well,
within 5 days, you were like,
Yes,
feeling
it's
great.
important to have a team, your own team as well. So I would encourage
Yes.
anyone that if you're going to have this, make sure that you have people around you that are going to help.
Yes.
That are going to encourage you. I had my husband, my daughter flew in from out of state. I had another friend around, so I had people that were supporting me through this and that were there. So that helped a lot because even like you said, just maintaining, making sure that you cleanse yourself properly and that your bandages and everything are taken care of. You need that help during that wound care period.
Wonderful. All right. And how would you say that this process and this surgery has changed your quality of life?
Oh my goodness. Okay. Don't make me cry. I tell realistically, we all know that appearance is everything. Even though we try to downplay it, oh no, you look fine. Oh no, appearance is everything for so many reasons. But more than anything, it helps you with your confidence. And it plays and it shows in every area of your life. And I feel like since I've had this surgery, I have a new drive now.
Wonderful.
I work with the public. I'm a realtor, so I'm constantly with people. And it feels good when you step out, when you have your clothes on and it fits you and it's laying nice, you sashaying and opening the doors for the homes and everything. You feel good.
Wonderful.
You feel good. You feel good how you're representing yourself.
Yeah.
And you feel good about how you're representing your business, your family. It just encompasses everything. So I would say that definitely another level of confidence I have is definitely displayed in everything that I do.
Yes, and that's very good feedback, especially for us surgeons. We do focus on the surgery, the results, the recovery, but it's always good to hear the stories of our patients, how it actually impacts all areas of their lives, which we don't train on that in medical school or in residency, but it is always nice to be able to hear that feedback, and it helps us, at least me as a surgeon, to grow even more than just, okay, I'm focusing on this, I'm going to make sure that this looks beautiful, it's great, and stuff, but it's impacting so many other areas of your life, all aspects of your social life, your work life, your interactions, at many levels.
Yeah,
really like
because
that.
It's like your mindset.
Yes.
So psychologically, you change, because we constantly hear people who, we all may have our good days and bad days, right? But every day you wake up and you feel good. You're excited.
Oh.
You're excited to get up and get out, and just show the world what you could do.
Absolutely.
So
I love that.
So I feel really, I know I feel different, and people see it. People see the change in me already.
Yeah.
You stand differently, you sit differently, you walk differently, you talk differently, because it's a confidence.
Like
It's a good confidence.
Yes.
It's not boastful,
right,
or it's not
or
an
arrogance.
ego or anything.
Right.
No, you just feel good. And so you deliver differently. You deliver differently.
I love it. Would you do it again?
Absolutely.
Okay.
Only with you.
All right. Well,
Only
wonderful.
with you and Linda. That's it. Only with your team. I would consider doing it again.
Much appreciated. So we're kind of getting to the end of the interview, and what advice would you give, or would you like to share with women who are considering having plastic surgery?
Oh, don't wait. If it's something that you want to do, really do it. We're living in a time now where everything, there's so much accessibility for things now, and if there's something that you want to do, I believe that you need to do it for so many reasons, because first and foremost, we never know what tomorrow may bring, right?
Very true.
But you need to live your life to the fullest. You need to be happy, and I find, like I had mentioned to you, that a lot of women, especially over the age of 40 and definitely over the age of 50, they feel like they just need to accept things. Like, it's okay, I had this fupa, I'm just gonna put a girdle on today. It's okay that, my pants are too tight, I'm 50. No, that's not the way you should live. You should live a quality of life 100% feeling good about yourself every single day. And it should not be acceptable that because I'm 50 years old or 55 years old that I can walk around with my gut. No. I mean, it's not healthy, and appearance wise, it doesn't look good.
Yeah.
So you want to feel good about yourself, because once again, it shows in every area. It shows in your communication with your family, with your loved ones,
Right.
because once again, it's the mindset. And if you don't feel good about yourself, you start showing and treating others the same way.
Right. Very good.
When you feel good about yourself, you treat people good.
Mm-hmm.
But when you feel bad about yourself, you treat people that way too.
It shows up, yes.
It shows up. So I would definitely encourage women, and especially women, and I mentioned to you before, women of color. This is an area where we've always, kind of like tippy-toed around it,
Right.
That conversation.
We
For
did
many
discuss
reasons,
that.
Financially, a lot of women, sometimes they feel like the investment is too much. They rather invest in other areas, which is okay, but you need to invest in yourself. So to me, this was an investment for myself, for
Right.
me.
Right.
Because we invest in our kids, we invest in our careers. You'll take a loan out for school, but you won't take a loan out or do something for yourself.
For yourself, yes.
For your body.
And like we mentioned, nowadays with plastic surgery being more mainstream, it's a lot more acceptable
Yes.
and definitely more accessible
Yes.
as well. But definitely want to do your research, find the right people, and people that are going to be, like you said, your team.
Yeah.
To take care of you.
Yes,
Yeah.
absolutely.
All right. Well, thank you very much.
Thank
it's been a
you.
pleasure, and I really appreciate it. Again,
I loved it.
this was our first one.
Yes,
So,
yes.
we are very thankful, and we look forward to taking care of you as well in the future, should you have any other needs, and we'll absolutely take care of any referrals that you send. I know you already have quite a few
But
on the way.
Thank you for
Absolutely.
your work.
Absolutely.
Thank you for your commitment and dedication to your patient, because I really appreciate the fact that you called. After the surgery, you checked on me. You followed up with my husband and make sure that I was okay, and that meant a lot. You didn't have somebody else to call; you called yourself.
Right.
So that spoke volumes to me as well. And so I'm very pleased that I selected you.
All right. Well, thank you very much.
Thank you.
All right.
Thank you very much.